Tonight we'll have the chance to check on the progress of Rising to the Challenge and to go deep into the Individualized Health Initiative, which is one of the campaign's priorities.
Hopkins in Health is an unprecedented cross-divisional effort, uniting clinicians and researchers, biostatisticians and engineers, physicists and nurses from 9 of our divisions, including the Applied Physics Lab, to help create the future of data-intensive medicine.
Leveraging the 100 years of science, and in particular the advancements in information and biotechnologies, the Hopkins in Health Initiative is to try to understand what makes each of you different from each other, and to use that understanding to advance each of your personal experience of health.
For the first time, we can begin to gather these data that predict individual differences among patients prospectively. For example, cystic fibrosis. We've learned that genetic variation in other parts of the genome influence how the patient will respond to their genetic disease.
We've learned the social determinants, the neighborhoods, the context, the human experience is different. So our health population has actually moved into the neighborhoods. We actually have nurses and clinicians in the barbershops, in the community, and we're actually training community health advocates to, again, tailor the care that we provide.
In radiation oncology, we have very complex delivery mechanisms that allow us to really tailor the dose distributions very well for these patients. So what we've done with OncoSpace is we've sort of built a learning health system within our department where we've developed a culture of data collection where each new patient's data feeds into the system and we learn with each new case.
Even if we had this level of understanding 30 years ago, we simply would not have had the computational power, the ability to handle data. Today we have the tools.
In interventional cardiology, it becomes a very humbling experience. Because even though we have thousands of experience in performing these procedures, we still must take that unique patient and assimilate it. And to have an assistive technology is what we're trying to create, and in health would be of tremendous value.
We believe that the potential for Hopkins to lead in this area is in truth without limit.
So as you know, Hopkins could not begin to tackle the enormous challenges and opportunities we've explored without philanthropy and contributions in every possible way from people like yourselves. While much remains to be done, we're confident that the momentum and the progress that we're now experiencing, thanks to your support, will propel us forward and enable us to succeed. So tonight I'm pleased to report that since January 2010, we have raised $2.8 billion, 63% towards our goal. Thank you all so much for coming, and again, thank you for all that you do for our university.